colorectal cancer screening. The topic is very much confusing for many of us, as because there are a number of authoritative body who provide guideline for colorectal cancer screening, as for example European guideline, American guideline, UK guideline and Australian guideline. Here I have made these box myself from the Australian guideline, that is the according to Red Book of RACGP. So let's start through this video. I have made this short table from the RACGP, that is the Red Book on colorectal cancer screening. So on the left side I put some criteria here. On the first row, colorectal cancer risks are divided in 3 groups: mild, that is average, moderate and severe. The second criteria is family history of colorectal cancer. In case of mild, that is the average, a person who has no family history of colorectal cancer or having any person in his or her family who has the history of colorectal cancer after 60 years of age. So here the age bar is 60. If anyone else in your family get colorectal cancer after the age of 60 years, that means you have average risk, or that is mild risk group. And anyone else of your family affected by colorectal cancer before the age of 60, that means that you will be in the moderate risk group of colorectal cancer. And anyone of your family get colorectal cancer before the age of 50, that means you will be in the group of severe risk group. Actually, I have simplified this group in my own way, and it is the absolutely right, but there are some other conditions you will find out if you will go through the guideline, that is the Red Book. So now the second criteria, FOBT, that is fecal occult blood test. FOBT, according to the latest guideline, that is RACGP 10th edition, FOBT will be done only in case of who are in the average group, and it will be started from the age of 45. From the age of 45, for the general population, colorectal cancer screening should be started. It is the number 1 recommendation for general population. FOBT started at the age of 45, and it should be carried out up to 74 years age. In case of moderate and severe group of person, FOBT not recommended. Number 3 criteria, colonoscopy, and it should be done 5 yearly, and FOBT 2 yearly. So to whom the colonoscopy should be applied for? Those who are in the moderate group and severe group, colonoscopy should be undertaken. Now the question is, when should be undertaken for moderate and severe group? It is crucial, very important and critical to understand and to memorize. 10 years earlier from the diagnosis of colorectal cancer of your affected family person, or the patient is 50, who is one is earlier. So I repeat again, the question is when colonoscopy should be started in moderate and severe group. In case of moderate group, it is 10 years earlier from the diagnosis of colorectal cancer of your family member who had been affected by colorectal cancer, or your age 50, who is one is earlier. As for example, if your family one of your family member affected by colorectal cancer by the age of 56 years, and now your age is like 50 years, so what should be done? 56 minus 10, that means 46. So at the age of 46, colonoscopy should be started, and by this time you are 50 years old, so colonoscopy should be started just now. So 10 years earlier from the diagnosis of colorectal cancer, or patient is 50, which one is earlier? Next, severe, just like the same, but the age bar is 40. 10 years earlier from the diagnosis of colorectal cancer of your affected family person, or the patient age is 40, which one is earlier? So in case of moderate and severe group of person, colonoscopy should be taken 5 yearly, every 5 yearly. And last point is aspirin low dose 100 milligram. In case of general population, that is average population, group of population, aspirin not recommended. It is recommended only for moderate and severe or high risk group of person, and it should be started from the age of 45, as because 45 years of age, it is the age bar from which FOBT should be started, and it is the age bar 45 from which aspirin should be started for those having moderate or high risk, severe or high risk. So who are in the group of moderate group or severe or high risk group, aspirin should be started from the age of 45, and those who are in the average group, that is general population, without any specific risk factor, FOBT should be started too early from the age of 45. So this is all about regarding colorectal cancer screening according to RACGP 10th edition. Thank you.